Okay, so we are looking at a posterior view of the trunk model here, and we're going to go through all the muscles on the trunk starting superiorly. If we look here at this group of muscles just inferior to the skull, we have the group of 4 suboccipitals. So there are 2 rectus muscles in that group, rectus capitis posterior major, the longer of the 2, and rectus capitis posterior minor. And then 2 diagonal or oblique muscles, obliquus capitis superior and obliquus capitis inferior. This muscle that has been cut is semispinalis capitis. If we look at the cervical spine, we have 2 examples here of interspinalis, and then just off to the side we have 2 examples of rotatorus. Also in the cervical area we have the scalenes. So from the posterior view you can see middle scalene and posterior scalene. If we turn this model slightly, you can also see the anterior scalene here, which we'll look at again at the anterior view. Moving to the thoracic area, we have multifidus on either side here, rotatorius, which is slightly smaller, and then intertransversarius. Moving to the lumbar region, we have the quadratus lumborum, erector spinae with their straight up and down fibers. This group here is part of the transversospinalis group with the diagonal fibers, and this example here is of multifidus, which is most prominent in the lumbar spine. Again, we have intertransversarius. And then we're going to move back up to the shoulder to look at the rotator cuff muscles. So on the posterior side of the scapula, we have supraspinatus up here, superior to the spine, infraspinatus here, teres minor, this small little sliver, and teres major, which travels anteriorly to the anterior side of the humerus. The last rotator cuff muscle is on the anterior side of the scapula, subscapularis. And then one more group on the posterior side, we're going to look at the hip. So looking at the hip here, we have gluteus medius, which has been cut. Deep to that is gluteus minimus. And then we have 4 of the deep lateral rotators of the hip: piriformis, gemellus superior, obturator internus, and gemellus inferior. And then finally, we're going to look at the anterior view of this trunk model, starting up again in the cervical region. So here we can see longus capitis, longus colli, and then again here we have the anterior scalene, which we talked about previously. If we go down to the hip, one more muscle here, we can see psoas major and iliacus, which would come together to form iliopsoas just past the inguinal ligament.